following is my experience with the Queensland healthcare system, provided after the car crash incident my family and I were involved in. The paramedic who attended the car crash site was professional, compassionate, and gave excellent service to myself and my family. She talked to me and reassured me while efficiently stabilizing my condition. I was extremely relieved when she arrived and attributed my own and the lives of the family to her actions.
The first encounter with the patient was at the site of the crash. The patient name is Kyra and 3 hours elapsed between the accident and my arrival. Unfortunately, her lower limbs were untrapped and encapsulated for more than 3 hours. From her facial expression, I deduced that she was fearful, in pain, and anxious. I calmed Kyra down and diverted her attention away from the pain to responsive communication with respect and reassurance. Meanwhile, I took her blood pressure, pulse, respiratory rate, and Glasgow Coma scale while checking for injuries. During the examination, I kept her attention, asked her questions, and reassured her that everyone was in safe hands. During our conversation, she complained of a slight back pain. To prevent further injury, I stabilized her on the stretcher very carefully and slowly with the help of my colleagues. Without any further delay, Kyra was transported by road ambulance to Charleville, and she was then flown to Royal Brisbane and Women's Hospital. Once at the hospital, a thorough clinical handover was carried out to the nurse.
After Kyra arrived at the Royal Brisbane Women's Hospital, I received a handover from Claire, who was the paramedic who escorted her. I was told Kyra has a possibility of a broken femur and felt pain in both her shoulders amongst other issues. It was obvious that she was distressed and anxious through her tense body language, and as a nurse it was my duty to assist Kyra's needs whilst adhering to protocol. As my team of nurses were preparing the IV drip, vital sign and blood pressure monitor, I asked Kyra for her name and date of birth to confirm her identity. She was made aware that she would receive several x-rays and CT scans for her femur and the pain in her shoulders, as not knowing what was happening would further distress the patient. She was also updated about her family to reduce her anxiety. Prior to Kyra's discharge from the hospital, I offered her and her family with different options for support services that would best assist them during their recovery. This included transport arrangements, home care nurses, and support hotlines, to name a few. Kyra's discharge summary was forwarded to the pharmacist Thomas, who later consulted with her regarding her medication and treatment.
Post Kyra's admittance to the Royal Brisbane Women's Hospital, it was my job as the hospital pharmacist to review, dispense and give advice to Kyra and the healthcare team regarding medication usage. Kyra was not taking any prescribed medications before her accident, however she was taking complementary medications, one of which was ginkgo. Ginkgo interacts with anticoagulants, increasing the risk of bleeding, which could prove a setback for her surgery. Kyra was concerned about taking medications such as radioactive iodine. I discussed alternative treatments with her and reassured her that when radioactive iodine is taken, it concentrates in the thyroid gland, destroying cancer. I also informed her of the possible side effects. I also discussed pain medication after surgery, and regarding the cost, I reassured her that as a Medicare card holder, she is entitled to the pharmaceutical benefits scheme, which significantly reduces the cost of her medications. Before she was discharged from hospital, I consulted with the doctor concerning Kyra's wishes and future pharmaceutical treatments to be included in her discharge summary.
The radiation therapist was professional and conscious and gave me the feeling that my opinions and questions mattered. I felt comforted by his cultural awareness and his answer to my question regarding study and expense.
After reading the discharge summary and correspondence from the referring doctor, Kyra's historical health record was cited via My Health Record. Communication between health professionals via referral was thorough and conveyed with respect. The meeting was focused around patient-centered care. Kyra was treated with dignity and respect, displaying awareness of the cultural needs of the patient. I explained information about Kyra's condition, including prognosis, treatment options, potential side effects and costs. Kyra was put at the centre of care by offering her educated professional opinions and explaining the intricacies of the treatment options. This allowed her to make better health decisions regarding her healthcare. I assessed Kyra's health literacy and tailored the responses to ensure comprehension. Multiple options which reduce the impact of the radiation therapy side effects were offered to Kyra. The treatment will not greatly impact on Kyra's schedule of PhD studies, as the sessions are only 15 minutes long and for a duration of 33 consecutive days. Addressing the cost of treatment, I reassured Kyra that the radiation therapy services are supported by the Australian Government through Medicare. Further to this, Townsville General Hospital is the public facility which handles radiation therapy and will be most convenient for Kyra to attend her treatments.
I'd like to take this opportunity to thank the health professional involved in my treatment. The support provided to us was comprehensive and made my life easier during recovery. Thank you.